Testosterone is one of the most discussed hormones in men's health, and also one of the most misunderstood. A lot of men hear the word and immediately think only about sex drive, erections, or muscle size. But testosterone is involved in much more than that. It plays an important role in libido, sperm production, mood, bone health, red blood cell production, body composition, and the maintenance of muscle mass and strength. Low testosterone, or male hypogonadism, is also more common in men with obesity, type 2 diabetes, and increasing age. The problem is that testosterone usually does not drop because of one dramatic event. In many men, the decline is more subtle and more connected to lifestyle than they realize. It can be influenced by sleep quality, body fat, physical activity, alcohol use, certain medications, and overall metabolic health. That means some daily habits may be quietly working against you, even if you are not noticing the effect right away. So in this video, we are going to talk about 5 habits that may be reducing your testosterone without you realizing it. This is not about fear, and it is not about promising that one hack will fix everything. It is about understanding how the body works, how hormone regulation can be disrupted, and which patterns may be making things worse over time. The first habit is sleeping too little or sleeping badly on a regular basis. This is one of the most underestimated habits in men's hormonal health. A lot of men think of sleep as optional, something they can trade for work, stress, late-night scrolling, or early training. But testosterone production is tightly linked to sleep. Research has shown that sleep restriction and sleep disruption are associated with lower testosterone, and the Endocrine Society also highlights that healthy testosterone rhythms are tied to normal sleep patterns. In one well-known study, just 1 week of restricted sleep in healthy young men significantly reduced daytime testosterone levels. And this matters because the damage is not always obvious in the beginning. You may simply feel more tired. Your motivation drops. Your recovery gets worse. You feel less interested in sex. Your gym performance flattens. Your mood gets shorter and your focus weaker. Many men blame stress or age alone, when in reality, poor sleep may be one of the main reasons the hormonal environment is shifting in the wrong direction. The second habit is slowly gaining abdominal fat through overeating and poor food quality. This is probably one of the strongest lifestyle patterns linked to lower testosterone. Obesity, especially central or abdominal obesity, is strongly associated with lower testosterone levels in men. The relationship is not just cosmetic. Excess body fat changes hormone handling in the body, affects insulin sensitivity, and is associated with lower sex hormone binding globulin and lower circulating testosterone. In practical terms, the more a man moves toward chronic overeating, ultra-processed foods, and increasing waist size, the more likely he is to create the metabolic conditions that push testosterone down. This is one reason why many men say they no longer feel like themselves after years of weight gain. They feel heavier, less driven, less sexually interested, less energetic, and less physically capable. And while not every man with excess body fat has clinical hypogonadism, obesity is one of the clearest red flags in this conversation. That is also why lifestyle-driven weight loss often improves testosterone levels in men carrying excess body fat. The third habit is living too sedentarily. A lot of men today are not just not training enough. They are barely moving at all. They wake up, sit in traffic, sit at work, sit during meals, sit with their phone, and sleep poorly at night. That pattern does not only affect the heart and the waistline, it also affects testosterone. Clinical and review sources consistently point to lack of exercise, unhealthy diet, and poor sleep habits as contributors to declining testosterone patterns in men. Regular physical activity, especially resistance training, is associated with healthier testosterone dynamics, while inactivity pushes men toward the opposite direction, partly by worsening body composition and metabolic health. And here is what makes this habit dangerous. It feels normal. Sedentary living has become so common that men stop seeing it as a hormonal problem. But the body was not designed to spend almost all day inactive. Muscle is metabolically active tissue. Physical training supports body composition, insulin sensitivity, and hormonal signaling. When movement disappears, Men often lose muscle, gain fat, and enter a cycle where lower energy leads to less activity, and less activity leads to a worse hormonal profile. The fourth habit is drinking heavily on a regular basis. Alcohol is one of those topics where men often want a simple answer. They want to know whether one drink destroys testosterone, or whether all concerns are exaggerated. The real answer is more specific. Occasional moderate intake does not necessarily affect every man the same way, but heavy alcohol use is clearly associated with worse male reproductive hormone function. Alcohol can interfere with the hypothalamic pituitary gonadal axis and impair testosterone production at multiple levels, including effects on the testes themselves. Reviews of the literature have repeatedly found that heavy drinking is linked to reduced testosterone and impaired male reproductive health. This means the issue is less about one social drink and more about the pattern. If a man is drinking heavily every weekend, binge drinking, or using alcohol as a nightly stress tool, he may be quietly damaging sleep quality, recovery, body composition, and testosterone regulation at the same time. That is one reason alcohol can create a perfect hormonal storm. It does not just hit one system. It hits several systems that all matter for testosterone. The fifth habit is relying on chronic opioid use or similar suppressive substances without understanding the hormonal cost. This is a less talked about issue, but medically it is very important. Chronic opioid use is a recognized cause of low testosterone in men. Opioids can suppress the hormonal signaling pathway that begins in the brain and ultimately stimulates the testes to produce testosterone. This condition is often referred to as opioid-induced hypogonadism or opioid-induced androgen deficiency. It is under-recognized, and some men on long-term opioids may attribute low libido, fatigue, depressed mood, erectile problems, and low energy to pain or age, when the medication itself may be contributing significantly. Now, if you are prescribed medication, this is not a message to stop treatment on your own. It is a message to be aware that some substances can affect hormones and that persistent symptoms deserve proper evaluation, not guesswork. The same general principle applies to recreational drug use and self-medication habits. Anything that chronically disrupts the brain-body hormone axis can eventually show up in testosterone-related symptoms. There is also one more pattern worth mentioning, because some men accidentally create it while trying to get leaner or healthier. Extreme dieting, chronic undereating, or very low energy availability can reduce testosterone as well, especially in athletes or men who combine high training loads with insufficient calories. In other words, testosterone does not only fall when men overeat and gain fat, it can also fall when men underfuel the body for too long. The body interprets persistent energy shortage as a signal that conditions are not ideal for maintaining robust anabolic hormone output. So what is the practical message here? If you want to protect your testosterone, you should think less like someone searching for a miracle supplement and more like someone protecting an entire biological system. That means sleeping enough and sleeping well, keeping body fat under control, lifting or training regularly, limiting heavy alcohol use, being cautious with chronic opioid exposure, and avoiding extreme diets that leave the body chronically underfueled. These are not flashy recommendations, but physiologically, they make far more sense than chasing shortcuts. It is also important to say this clearly. Low testosterone symptoms are not specific. Fatigue, low libido, depressed mood, erectile problems, poor recovery, and loss of strength can overlap with sleep apnea, depression, obesity, diabetes, medication effects, overtraining, and other health conditions. That is why real diagnosis matters. Clinical guidelines do not diagnose testosterone deficiency from symptoms alone. Men with suspected hypogonadism should be evaluated with morning testosterone testing and proper medical assessment, especially when symptoms are persistent. The body usually gives signals before bigger problems become impossible to ignore. If your sleep is collapsing, your waistline is growing, your activity is falling, your drinking is increasing, or your recovery and libido have been noticeably worse for months, do not just normalize it. Sometimes what looks like getting older is actually a pattern of habits pushing your hormones in the wrong direction. Testosterone health is not built by one pill, one food, or one motivational speech. It is built by protecting the conditions that allow the body to regulate itself properly. And very often, the habits lowering it are the same habits quietly damaging the rest of your health too.